Okay, so we all know that approximately at the level of approximately at the T5, there is a bifurcation of the inferior portion of the trachea into the two bronchus. So we have the right bronchus and the left primary bronchus here. So, taking into consideration the right bronchus first, you can see that it's about 2.5 centimeter in length. And as compared to the left bronchus, there is a peculiar observation because this is more vertically inclined and it's more larger in diameter as compared to the left bronchus. And hence, you can notice that most of the cases of choking are related to abnormalities due to the food particle or anything that's swallowed being stuck in the right bronchus, because of course you can see the caliber, the diameter is quite wider as compared to the left bronchus. Another thing that you can notice is that there's a division of the right bronchus into two branches. So the first branch is also known as the superior branch, which is and then there's an inferior branch, which is of course at the inferior portion, the inferior branch, and then we have the bronchus intermedius or the middle branch. So three branches of the right ventricle, of the right bronchus. There are a lot of structures in the vicinity of the right bronchus, but the two major structures that are in direct relation with the right bronchus are the azygous vein. The azygous vein arches over the right bronchus and the pulmonary artery. The pulmonary artery is present on the anterior aspect. So the bronchus divides posterior inferiorly and posterior superiorly, and you can see that the pulmonary artery is present right in front of the bronchus. Another thing to consider is that both of the arteries enter the hilum of the lung. Now let us look at how the superior division of the right main bronchus is supplied to the lungs. So we know that the right lung is divided into three parts: the upper lobe, the middle lobe, and the lower lobe. So the first superior branch that comes up of the right bronchus divides into three more segmental bronchi. So the first segmental bronchi is known as the apical segmental bronchi. Then we have the posterior, and then we have the one that projects anteriorly. So as you can see here, and all of them enter the lung and supply the apical or the upper lobe of the lung. So we have the apical segment here that projects posterolaterally, the posterior segment here that also projects posterolaterally, and then we have the anterior segment that projects anterolaterally and provides all of the apical lobe of the lung. Sorry, the superior lobe of the lung. All right, so we know for the fact that the right main bronchus divides into two lobar bronchus. So we have the superior lobar bronchus, and then we have the inferior lobar bronchus. And these lobar bronchuses, now they have their segmental parts. So the superior one here, the superior divides into the apical, and then we have the posterior segment, and along with it we have the anterior segment. So the apical, the posterior, and the anterior segment. Now then there is also another division known as the inferior bronchus. Now the inferior bronchus is quite complex because the first thing that comes off of the main bronchus on the inferior side is known as the intermediate bronchus intermedius. And bronchus intermedius is about 2 centimeter in length, and the division between the superior bronchus and the inferior bronchus is about 2 centimeter in length. Then what we can see here is that this gives rise to the medial bronchus, and then we have the medial lobar bronchus, and then we have the inferior lobar bronchus. So intermediate gives rise to 2 lobars. So until we have 3: the superior lobar, the medial lobar, and the inferior lobar. So the medial lobar here gives rise to segmental bronchus, and the segmental bronchus are smaller smaller divisions of the lower bronchus. So we have the medial segmental bronchus of the right lung, and then we have the lateral segmental bronchus. So anything that projects towards the lung is known as the lateral bronchus. And so two of the medial one, and this supply the medial compartment of the lung. So the apical compartment is done, the medial compartment is done. Now we have the basal compartment. And inferiorly of the superior lobe, we have the supply to the anterior basal segment bronchus of the right lung. So anteriorly projecting outwards, the first branch of the medial of the inferior lobar bronchus is the anterior basal, and then we have the posterior basal. The superior basal. Then we have the medial basal, and then the posterior basals. So yeah. And then we also have the lateral. So basically, as you see here, the medial, the posterior or inferior lobar bronchus has 1, 2, 3, 4, 5. So we have the anterior, we have the anterior, then we have the superior, and then we have the posterior, and then we have the two laterals. So yeah, so remember that in mind. So the posterior and the lateral. So 4, 1, 2, 3, 4, and 5 of them. Alright, so if you look at the left lung, you can see that unlike the right lung, the left lung is divided into two lobes. The first lobe is known as the upper lobe, and then the lower lobe. So it's pretty self-evident if you look at it. There is the crown of the left lung known as the apical region, and then we have the mid region, and then we have the lowermost region. But in case of the left lung, the upper lobe and the lower lobe is also divided into three parts. The first part is the apical, then we have the anterior part, then we have the superior part and the inferior part. And we have a projection inside the left lung known as the lingula. So the lingula is an anterior-inferior projection of the left lung that is supposedly it actually demarcates the border of the heart. So the heart is placed obliquely in the lungs, in the mediastinum cavity, and the lingula is a sort of flap that curves around the surface of the heart. So yep, that's the lingula. Now, we'll keep that information aside and understand how the primary bronchus, the left primary bronchus, is divided into its lobular part and its segmental part, and how it branches off inside the lung. So, as we can see here, now another thing that you can notice here is the fact that the left bronchus, the left primary bronchus, is quite smaller in diameter of the left primary bronchus is quite smaller as compared to the right primary bronchus, and it's more horizontally aligned, and it's not quite steep as compared to the right bronchus. So the division or the branching out of the left primary bronchus is somewhat similar to the right primary bronchus. Here again we find two lobular branches. The first lobular branch is the superior lobular branch. It further divides into the apical, lateral, and the inferior. And then we also have the inferior lobar branch here. And this branching approximately happens at the level of T5. And also another thing we can see is as compared to the right primary bronchus, the right primary bronchus is smaller in length as compared to the left primary bronchus. The left primary bronchus is about 5 centimeter in length, and the right primary bronchus is about just 2.5 centimeter in length, so basically half of the size. And now that's basically the general division and the structure of the bronchuses. But now, what are the structures that are in close proximity? Because it's important to know certain structures in order to know where the disease is present in relation to what. So you can see here that there are a lot of structures that are in close proximity, especially the tubular parts. So we have a lot of great vessels, and then we have one organ, the esophagus, that's in close proximity. So starting with the we have this esophagus that's on the posterior aspect. Then there's also the arching of the aorta. Then we have the pulmonary artery that also branches into certain parts, just like we have the branching of the bronchus, the right primary bronchus. Then at the posteriormost portion, you can see that there is this thoracic duct in green right there. So remember, we have the esophagus, then we have the thoracic duct in green, and then we have the arch of the aorta that arches off of above the left primary bronchus, and then we have the descending thoracic aorta right here. And then we have the pulmonary artery. Alright, so if you look at the left lung, you can see that unlike the right lung, the left lung is divided into two lobes. The first lobe is known as the upper lobe and then the lower lobe. So it's pretty self-evident if you look at it. There is the crown of the left lung known as the apical region, and then we have the mid region, and then we have the lowermost region. But in case of the left lung, the upper lobe and the lower lobe is also divided into three parts. The first part is the apical, then we have the anterior part, then we have the superior part and the inferior part. And we have a projection inside the left lung known as the lingula. So the lingula is an anterior-inferior projection of the left lung that is supposedly it actually demarcates the border of the heart. So the heart is placed obliquely in the lungs, in the mediastinum cavity, and the lingula is a sort of flap that curves around the surface of the heart. So yep, that's the lingula. Now, we'll keep that information aside and understand how the primary bronchus, the left primary bronchus, is divided into its lobular part and its segmental part and how it branches off inside the lung. So, as we can see here, now another thing that you can notice here is the fact that the left bronchus, the left primary bronchus, is quite smaller in diameter of the left primary bronchus is quite smaller as compared to the right primary bronchus, and it's more horizontally aligned, and it's not quite steep as compared to the right bronchus. So but the division or the branching out of the left primary bronchus is somewhat similar to the right primary bronchus. Here again we find two lobular branches. The first lobular branch is the superior lobular branch. It further divides into the apical, lateral, and the inferior. And then we also have the inferior lobar branch here. And this branching approximately happens at the level of T5. And also another thing we can see is as compared to the right primary bronchus, the right primary bronchus is smaller in length as compared to the left primary bronchus. The left primary bronchus is about 5 centimeters in length, and the right primary bronchus is about just 2.5 centimeters in length, so basically half of the size. And now that's basically the general division and the structure of the bronchuses. But now, what are the structures that are in close proximity? Because it's important to know certain structures in order to know where the disease is present in relation to what. So you can see here that there are a lot of structures that are in close proximity, especially the tubular parts. So we have a lot of great vessels, and then we have one organ, the esophagus, that's in close proximity. So starting with the we have this esophagus that's on the posterior aspect. Then there's also the arching of the aorta. Then we have the pulmonary artery that also branches into certain parts, just like we have the branching of the bronchus, the right primary bronchus. Then at the posteriormost portion, you can see that there is this thoracic duct in green right there. So remember, we have the esophagus, then we have the thoracic duct in green, and then we have the arch of the aorta that arches off of above the left primary bronchus, and then we have the descending thoracic aorta right here. And then we have the pulmonary artery. So yeah. So the next thing that one can observe here is the bronchial artery. So if you look at the bronchial artery, it's quite difficult to actually notice it inside because it's situated right on the anterior side of the spine. So approximately at the level of, I'm sorry, yes, just undo approximately at the level of basically at the level of T, thoracic vertebra 5th and 6th. So near at the point where there's a bifurcation of the trachea, we can see near the bronchus, we can see that there are arising from the intercostal. So you can see here that from one of the intercostal veins, approximately, I suppose, the 5th one here, the 3rd posterior intercostal vein, we have the bronchial arteries. And now this bronchial artery is not singular in nature. So it has a branch that supplies the esophagus, and it has another branch that goes and supplies the bronchi. So it's multiple, like it branches off to supply two entities, and they both arise. Now the intercostal arteries, we all know that the intercostal artery arises from the great vessel called as the thoracic aorta. So just remember the fact that the bronchial artery arises from the thoracic aorta. And it's so thoracic aorta, and then we have the intercostal arteries, and then branching off from the posterior side of the 3rd intercostal arteries, we have the two branches of the bronchial arteries. So one supplying the esophagus and the other supplying the actual bronchi. Now, quite similarly, we can see the arrangement of the bronchial veins that are just adjacent, that are placed just adjacent to the bronchial arteries right here. So we have the bronchial arteries, and right adjacent to it, we have the bronchial veins. That's quite interesting because bronchial veins are further divided into superficial and the deep side. So the deep ones are the ones that are more associated with the pulmonary veins. So the deep ones drain into the pulmonary veins because essentially it's just important to keep in mind for time being that they are entangled inside the pulmons or the lungs, and they're quite related also to the hilar structure of the lung. So they enter the hilar structure of the lung. And next, and they're quite different from the superficial ones right here, because the superficial ones are the ones that are going to be draining on the inside the hemiazygos. So just like we have the carotid artery and the carotid vein and the jugular vein, and they both lie approximately side by side, we also have the azygos vein, not the hemiazygos, I'm sorry. So we have the azygos vein that lies approximately that lies adjacent and towards the right of the thoracic aorta. So the main thoracic aorta is the artery, and the one that's quite similar, like the vein counterpart of the thoracic aorta, is known as the azygos vein. And the azygos vein is the vein that receives all of the drainage from the superficial bronchial artery, and the deep ones, they go into the pulmonary veins. The lungs. The lungs are organs of respiration, and they are located in its chest wall. We can also say that normally the lung is covered by. It is free in the pleural cavity except in the hilum and the pulmonary ligament, which is attached to the mediastinum. So the location of the lung is in the mediastinum in the thoracic cavity, and on either sides of the lung. The shape of the lung is roughly a conical, half a cone-like structure, and it weighs 625 to 525 grams. And a normal lung, the capacity of a normal lung is about 1,000 to 1,500 liters. It is spongy in nature, and it's also important to know that the left lung is a little bit the left is a little bit smaller than that of the right. So that's how we're done with the function, the location on the basis of the mediastinum and the organ. The shape, that's a cone, and then the general organ in the vicinity, that's the heart. The size and the weight of the lung, that's about 525 to 675. The extreme points, the surfaces, and the borders of the lungs. It has an apex, a base, and 3 borders, and 2 surfaces. So let's now first look at the points, that's the apex and the base. Then we will look at the 2 surfaces, and then we will look at the 3 borders. 3. Apex. The apex is a rounded upper extremity. And to get the location of this entity, we can say that it's at about the level of the first costal cartilage, in fact 3 to 4 centimeters higher. It only ascends to the highest position when in the method of... So as you can see here, the first thing that we need to consider whenever we speak about the relations of the lungs, the other thing that comes into consideration is also the impressions that all of these relations make on the lungs. So impressions are mostly built upon the relations of the anterior or the apex region of the lung. So here we can see that most of the apex of the lung is in relation with the great vessels of the heart. So the first thing we can notice, let's take the right lung for instance. The right lung is first and foremost related to the subclavian artery right here. So the subclavian artery and the brachiocephalic trunk, the subclavian right here and the brachiocephalic trunk right here are in relation with the apex of the lungs in the interior side. Next thing we have is the superior vena cava. The superior vena cava is and the right brachiocephalic vein. So the superior vena cava and the branch of the superior vena cava is the right brachiocephalic vein. These both are also in relation with the apex, the apex of the lungs. Another structure we can notice is the right ventricle. Most of the right ventricle is covered by the right lung in such a way that it sort of engulfs it in this side because it's oblique in nature. We know that the heart is obliquely placed inside the thoracic cavity. So that's it. And another thing inferiorly we can notice, it's not easy to see here, right here, but if you can look, the fact that the inferior vena cava right here, it goes inside the diaphragm to the diaphragmatic hiatus and it goes into the heart. So we can also say that the inferior vena cava also has an impression in the interior portion of the lung. Now let us move on towards looking at the inferior organelle relations. So we know that the right hypogastrium is made up of the liver. The right hypogastrium. So there's a line through the gastrium to the gastric region right here. There's an imaginary line that divides the body into 2 parts. There's an imaginary vertical line, and this line, under this line we can notice that we have the liver, and this liver is present right below the diaphragm, right below right below the right lung. So we can say that this is an indirect relation. So that was these relations. But now another thing that we can notice is the fact that there are certain ganglions that are in relation with the lung that have an impression. So right here we can see it's not pretty it's not easy to visualize it, but right here the yellow structure right here, it demarcates the nerve. So we have the ganglion, the thoracocervical ganglion. So ganglions are basically nodes that are present somewhere right here. So somewhere right here. And these are the yellow things. And then we have the azygous vein too. The azygous vein right here, the one in blue, it creates an impression. Then we have the esophagus that also creates an impression, mostly in the right lung, because we can see that it curves in such a way that it is more inclined towards the right as to the left. The right here has an impression on the on the right lung. The next thing that we can see is some of the relations with the trachea. All right, so as you can see here, the 2 lungs, we have the right and the left lung. So considering the right lung first, we can see that it's divided into 3 parts with the help of 2 fissures. So there's one long fissure and then there's one short fissure. The short fissure is also known as the vertical fissure. That's the horizontal fissure. that is here approximately, and it's more anteriorly placed as compared to the oblique fissure that is both anteriorly and posteriorly placed. So the oblique fissure here is more steep, as it's not more steep as compared to the fissure on the left side, because on the left side too, in the left lung too, we have a fissure that's more steeper and divides the left lung into two parts. As compared to the right lung, which is divided into three parts. So these three parts are the superior lobe, the inferior lobe, and the middle lobe right here. So let's look how this oblique fissure, that's the major fissure, how does it project? So the projection at the posterior side here, the posterior side, it starts from approximately at the level of the T4. More or less the inferior border. So the inferior border of the T4, fourth thoracic vertebrae, and it goes all the way to the anterior side, takes a U-turn, and then approximately at the level of the sixth thoracic vertebra, it divides into, it meets the vertical fissure right here, the horizontal fissure right here, and then it goes posteriorly downwards. So this horizontal fissure, the demarcation here of this is the line of the sternum. We have the fourth costal cartilage right here, and that attaches itself to the sternum. So right here is a demarcation of the lingula of the lungs, right? Sorry, not the lingula, the border that corresponds to it, the vertical border corresponds to, the horizontal border corresponds to the fourth T4, the fourth costal cartilage right here. So that was the right lung. The left lung is less complicated right here. The only thing that we need to know is the cardiac notch. So you can see that there's a cardiac notch right here that traces the cursor. So this is the cardiac notch, and the cardiac notch leads to the formation of a lingula right here. And then there is the oblique fissure right here, but this is not, as complex as what we saw in this in the right lung. So two divisions here, three division here, two fissures here, one fissure here. That's basically what you need to know.